Greetings, everyone. My name is Candy Bowen, and I serve as the new administrator of Bowen Christian Behavior Health and Wellness. I want to thank you for being here today as we go over some key concerns that I noticed that we were having. So, we are a outpatient mental health program serving adolescents, including the uninsured and the underinsured. We offer individual and group therapy, psychiatric evaluation, and biblically grounded counseling. Our operational philosophy is rooted in the belief that true healing addresses the whole person, the mind, the body, and the spirit. We are lifelong grounded in grace. Every decision carries a real weight for people made in the image of God. Our vision is a commitment to our community where every person experiences healing and restored restoration through compassionate clinical excellence, compassionate and biblical sound behavioral health care. Our mission is to provide accessible, evidence-based, and Christian-centered outpatient services. Outstanding claims are sitting 90 to 120 days in our buckets. That have to change now. We will not survive as a company continuing that way. We are going to have to start collecting our copays. We have to complete our notes and review our escalated claims. Our goal is to turn everything around within 60 days of operating, revising and tightening up our billing schedule. So everything should be completed within 60 days. Our five organizational goals are to increase our client access, focus on the faith integrated outcome, ensuring financial sustainability, strengthen our workforce, and to expand faith partnerships. We have 78% collection rate. That means that 22 cents of every dollar is not being collected. That creates a huge gap for us. That's about 340K in financial negligence. Yes, negligence. I said that correctly. Now, financial negligence is a demonstration of poor stewardship. We must collect what we've earned. We must be able to have the finances to support our clients. Inaccurate billing possesses a risk of fraud. I'm not trying to go to jail behind y'all. Our standards are going to be simple. If it's not noted, it can't be billed. Simple as that. We don't have the documentation, we can't bill for it. Now, we are going to revise our templates to implement compliance training, and we're also going to conduct quarterly interventions and quarterly internal audits. So, what is it that I need from you? As schedulers, I need you to collect our copays. Our clinicals, I need you to complete the documentation within 24 hours. If you can't remember what you wrote, we can't bill it. Our supervisors, I need you to actually review your team's productivity reports weekly. I need you to bring to me all type of questions directly to me. Excuse me. Now, integrity is our standard. Self-reporting is not a weakness. It is integrity, inaccurate documentation that breaks the trust we have with our clients, our founders, and our communities. The solution to documentation burden is never to falsify our evidence. Now, Luke 6 and 10 tells us whoever can be trusted with very little can also be trusted with much. Our clients, they trust us. They trust us with all their vulnerable information, their vulnerable feelings. Our founders, they trust us to build honestly. And most important, our community, they trust us to do what we say we're going to do. And when we are not providing accurate documentation, we're breaking that trust from everybody. Now, I am not standing here assuming that anybody has malicious intents. I know documentation burden is real, and I know that it can consume us. But I see that that sounds like a system problem, and that's going to be on me. Hence, why we are revamping our template, and we're going to actually be training everyone on the new template. And this training should take us to be fully effective. It should take us about 30 days to make sure that everything is in place. But the main solution, no matter what document that we're using, is to not to falsify that document. Remember, if it's not written, the service cannot be billed. If you cannot accurately recall what happened within that session a day later, that's not a billing issue. That's actually a quality concern issue. Now, going forward, we will conduct quarterly internal charts audits. Any discrepancies between the service that we're building and our documentation, I am going to be reviewing it. We're going to address these issues immediately. And unfortunately, if there is something that has to be reported to our agencies, we will have to report it. Now, reporting things is not a weakness, it's holding ourselves accountable and being integrity. Remember, on Psalms 15:4 describes that a person of integrity as one who keeps their oath, even when it hurts. That is the standard that we are going to be upholding. Now, my friends, my colleagues, I am proud of what this team has built. And I am excited where God has taken Bowen Christian Behavioral Health and Wellness. Our new business has an amazing blueprint, and I want your fingers all over it. I'm going to be scheduling one-on-ones with each of you. Um, within the next 2 weeks. We're going to be bringing, I want you to bring your questions. I want you to bring your concerns. I want to bring your ideas. I, I just want us to grow in Christ with our company. I want to thank each of you for your commitment to this work and to the people that we actually serve. We do not want to take lightly the privilege of walking alongside our adolescents and helping them through their darkest moments. Let's honor that privilege with excellent integrity and faith. Once again, I want to thank you for your time. I do apologize. I'm still under the weather, but I am healing fastly. We will meet in person soon. Um, but be prosperous and be integrity on purpose. Y'all have a great rest of your day.